Before entering the room, I'll first gather my supplies. I'm going to make sure that I'm wearing a face shield and face mask. I have my trach kit, suction catheter, disposable container, inner cannula, sterile saline, and trach stabilizer. So now that I have my supplies, I'll enter the room. Knock, knock, knock. Upon entering the room, I'll perform hand hygiene, 20 seconds. Good afternoon, Mr. Jones. My name is John Michael Lozada, and I will be your student nurse today. Now I understand that you're having some difficulty speaking, so if I could have you give me a thumbs up for yes, a thumbs down for no, and you could also raise your hand if you have any concerns or if you're feeling any pain or discomfort. Now is that understood, Mr. Jones? Thumbs up? Great. Now Mr. Jones, can I have you confirm that your full name is Jim Jones? Thumbs up. And that your date of birth is March 10, 1994. Thumbs up. Great. Let me go and scan your armband. Okay, that matches. Now, Mr. Jones, do you have any allergies, specifically to chlorhexidine, latex, or tape? Thumbs down. And are you experiencing any pain at the moment? Thumbs down. Okay. Now, Mr. Jones, today we are going to be suctioning the secretions from your upper airway. This will allow you to breathe much better. We're also going to be switching out your inner cannula, assessing and cleaning the site, switching out your dressing to prevent any contamination or infection. And finally, Mr. Jones, we're going to switch out your trach stabilizer. Now, do you have any questions or concerns about today's procedure? Thumbs down. Have you had this procedure done before? Thumbs up. Very good. All right, let me go ahead and check your vitals now. Your blood pressure, your heart rate, and temperature are within normal limits. Your respiratory rate is at 20, and your oxygen saturation is at 92. A little bit low, but the suctioning should help out with that. Now, Mr. Jones, do you have any shortness of breath or difficulty breathing at the moment? Thumbs down. Any coughing? Thumbs up. A little bit of coughing? Thumbs up. Okay. And I do notice you're not using your accessory muscles at the moment, so you're not exerting any extra effort when breathing, so that's good. All right, Mr. Jones, is it okay if I listen to your lungs underneath your gown? Thumbs up. All right. Okay, so I've already cleaned my stethoscope before I entered the room. If I could have you give me a good deep breath in and out. 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 Perfect. I do notice you have a bit of gurgling in your upper airways, but again, the suctioning should help out with that. Okay, so I've already assessed my patient. Let me go ahead and make sure that we have all of our emergency bedside equipment. I see that we have our 2 extra trachs, one size down, a size 6, and one size 8, matching his current size. We have our extra inner cannula. We have our ambu bag attached to our oxygen supply running at 100% oxygen, and our suction catheter attached to our suction canister running at 100 to 120 milligrams mercury. All right, so let me go ahead and close the door and give us some privacy. I'm gonna go ahead and put your bed in a high Fowler to semi-Fowler's position. I'll raise the head of the bed. Is that okay? Thumbs up. Okay. All right, just to aid with proper breathing. All right, let me go ahead and perform hand hygiene. And I'll don a pair of gloves so we can prepare our work area. All right. I'm gonna take a piece of sani cloth. I'm gonna wipe down the tabletop for a full 30 seconds. All right, Mr. Jones. So before we start suctioning you, it's really important that we hyperoxygenate you. In other words, I'm going to give you a couple breaths, about 2 to 3 breaths, so that your oxygen level is maintained throughout the duration of the procedure. Is that understood, Mr. Jones? Thumbs up. Do you have any questions or concerns about that? Thumbs down. Very good. All right, almost done here. Okay. Done with that, I'll dispose of this. I'm going to allow it to dry for a full 2 minutes. Okay, 2 minutes has passed. I'm going to place my supplies on the table. All right, and I'm going to doff my gloves. I'm going to perform hand hygiene, 20 seconds. Don a pair of gloves. And let's go ahead and switch out that suction catheter because I'm not too sure when it was last used. Dispose of that. Have the new one. Dispose of that. Making sure to only touch the outside and the part that is sheathed. Okay. While I'm here, I'm making sure everything is turning on. I'm turning on the suction, making sure it's working. Okay, it's working. It's running at 120 milligrams mercury. Checking the oxygen, making sure it's turning on. All right, that's working as well. It's running at 100% oxygen. Okay, so at this time, we can go ahead, open our trach care kit carefully, like so. Go ahead and grab the sterile gloves. We won't be needing that. Carefully grab the sterile drape, making sure to only touch within a 1-inch border. All right. That way, just in case your inner cannula falls, it has somewhere to land. So let me go ahead and open that box. Grab the inner cannula, drop it in, dispose of that. Grab the sterile saline, open it up, fill this about halfway, and also in the trach kit. Okay, dispose of my gloves. Perform hand hygiene, 20 seconds. Don another pair of gloves. You doing okay, Mr. Jones? Thumbs up. Great. All right, Mr. Jones, let's go ahead and hyperoxygenate you now. I'm noting that your oxygen saturation is at 92%. So let me go ahead and stabilize your faceplate. Remove your oxygen. Stabilize the faceplate. And apply the ambu bag. Okay, I'm going to give you 2 breaths, 6 seconds in between each one. All right, ready? First breath. 1, 2, 3, 4, 5, 6. Second breath. Stabilize the faceplate. Remove. And I'm noting that his oxygen saturation went up to 98%, so that's perfect. All right, Mr. Jones, let's go ahead and suction you now. All right, I'm going to pull this out about 2 to 3 inches. I'm making note of the pressure level right now is at 120, but when I place my thumb, I'm noticing it shoots up quite a bit. So I'm going to place it back down to 120 or adjust it back down. I'm going to grab a bit of sterile saline. All right. All right, Mr. Jones, are you ready? Thumbs up. All right, here we go. All right, Mr. Jones, how does that feel? Thumbs up. All right, good. All right, Mr. Jones, do you require any more suctioning? Thumbs down. Okay. If you required more suctioning, I would wait a minimum of 30 seconds in between each suction. And I noticed that his oxygen level is at 98% at the moment, so there's no need for any further hyperoxygenation. All right, Mr. Jones, let me go ahead and grab a bit of sterile saline just to clean it. I'll place this down. I'm going to place your oxygen back on you. And is it okay if I listen to your lungs once more? Thumbs up? Okay. All right. Clean my stethoscope. I'm going to grab the very corner again, only touching within a 1-inch border of the top. I'm going to listen to your upper airways. Deep breath in and out, and in and out. Okay. I do notice your lung sounds are clear and equal bilaterally, so that's perfect. Okay, so I'm going to go ahead and doff my gloves now. Perform hand hygiene, 20 seconds. And don another pair of gloves so we can start searching out your inner cannula and start cleaning. You doing okay so far, Mr. Jones? Thumbs up. Any pain? Thumbs down. Do you have any difficulty breathing or any respiratory distress? Thumbs down. Very good. Okay. So once again, I'm going to move on. I'm going to use my non-dominant hand to remove the oxygen supply. Very carefully. I'm going to use my non-dominant hand to stabilize and remove. Carefully remove the old inner cannula. Dispose of that. Grab the new inner cannula, making sure to only touch the tip, very top of it. Carefully place it inside and clip it in, like so. All right. Since I'm already stabilizing, I could also remove the dressing. Mr. Jones, do you have any shortness of breath at the moment? Any difficulty breathing? Thumbs down, thumbs down. Okay, dispose of that. Okay, since I'm already here, I'm going to assess the site. I'm checking the stoma for any redness, swelling, or inflammation. Everything appears to be normal. I'm also checking everything is also clean, dry, and intact, the skin. And I'm also checking the equipment itself, the faceplate, the trach, and the inner cannula, and the trach stabilizer. There appears to be no cracks, no tears, and the equipment is also intact and normal. So now that I've checked that, I can begin cleaning now. So I've already put saline in here. I'm gonna grab one Q-tip, dip, stabilize the faceplate, one swipe underneath, and that's gone. Another Q-tip, dip, switch hands. One swipe underneath on the top, dip, and that's gone. Okay. I'm gonna grab one wet gauze, dip. Gonna wipe the top of the faceplate, flip it over, wipe the other side as I stabilize, and that's gone. One more wet gauze so I can get the skin around. There's no need to wipe underneath with the wet gauze right now because there's no excessive secretions. I'll get rid of that. Okay. And finally, or second to last, I'll pat it dry. Pat, pat, pat. Pat, pat, pat. That way there's no extra moisture. Then I'll go ahead and put the split gauze underneath now. Like so. All right, Mr. Jones, we're almost done. Let me go ahead and get rid of my supplies here. I'll put your oxygen back on. Okay. And we'll be right back to switch out your trach stabilizer. But I'm going to need a second nurse for that. So I'll be right back. I'm going to put your bed in its lowest position. I will put both your side rails up, your call bell right next to you. Your environment is safe. And I'm going to go ahead and doff my gloves, perform hand hygiene, and I will be right back. Knock, knock, knock. All right, Mr. Jones, we're back. I'm going to perform hand hygiene, 20 seconds. I'm going to don a pair of clean gloves. Let's go ahead and switch out that trach stabilizer. You can remove your sterile drape, you won't be needing that anymore. And let me go ahead and call in my second nurse. I'm going to have her wear a face mask and goggles. And I'm going to have her perform hand hygiene and don a pair of clean gloves. So go ahead. All right. Before I remove your oxygen supply, let me go ahead and assess your vitals. Everything is within normal limits. And your oxygen saturation is at 98%. So let me go ahead and stabilize your faceplate and remove your oxygen. Okay, so if I could have my nurse stabilize her side as I remove my side. I'm gonna grab the new stabilizer. Dispose of that. I'm going to place one side in as my nurse continues to stabilize. Okay. Now, Mr. Jones, is it okay if we turn you on your side? Thumbs up? Okay. Gently turn him over. And while I'm back here, I'm assessing his neck. I am making sure there's no redness, no inflammation, no swelling. Everything appears to be normal, clean, dry, and intact. So let's go ahead and slip these underneath. As well. All right, slowly set them back down. Are you doing okay, Mr. Jones? Thumbs up, very good. I'm gonna stabilize my side as my nurse fixes her side. To dispose of the old stabilizer. All right, before you go, nurse, let me go ahead and ensure the fit. Gonna make sure at least 2 fingers fit in there. That way it's snug, but not too snug. All right, thank you, second nurse. I'm gonna go ahead and replace your oxygen now. Okay, Mr. Jones, are you in any pain at the moment? Thumbs down. Not too bad, right? Thumbs up. Do you have any questions or concerns about today's procedure? Thumbs down. Okay, let me go and doff my gloves and perform hand hygiene. And let's go ahead and switch out that suction catheter since we already used it. Dispose of the old one. Grab the new one. Okay, place that down right there. All right, Mr. Jones, we're almost done. So before I go, let me go and assess your vitals once more. Once again, your blood pressure, heart rate, and temperature are within normal limits. Your respiratory rate is at 20, and your oxygen saturation is at 98%. Okay, are you experiencing any shortness of breath or difficulty breathing? Thumbs down. No respiratory distress. Thumbs down. And do you have any coughing at the moment? Thumbs down. And I notice you're not using any of your accessory muscles to breathe, so that's good. You're not exerting any extra effort. So now, Mr. Jones, is it okay if I listen to your lungs underneath your gown? Thumbs up. Okay, I already cleaned my stethoscope. Breathe in and out, 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 in and out. Okay, his lung sounds are clear and equal bilaterally. All right, Mr. Jones, we're pretty much done. I'm gonna doff my gloves. I'm gonna perform hand hygiene. I'm going to put your bed in its lowest position. I'm going to put your call bell right next to you. I'm going to put both side rails up. And I'm checking your surroundings. Everything appears to be safe. Perform hand hygiene once again. Now, Mr. Jones, if you have any questions or concerns, feel free to ring your call bell, okay? All right. Thank you. Okay, so upon leaving the room, I'm going to document the date and time, the patient tolerance of the procedure. He tolerated it pretty well. He experienced no pain. I'm going to document the site assessment of the stoma. There was no redness, no inflammation. No swelling, everything was clean, dry, and intact, and his sputum displayed minimal thin white secretions. All of his vital signs were within normal limits, and his oxygen saturation was at 98%. Also, he experienced no difficulty breathing, no respiratory distress, or any coughing or shortness of breath of any sort. Thank you.